I'm so excited because anything to do with brain excites me, and
That's glad to hear
neurology
that. Yeah.
is so complicated.
I'm a neurologist, so that's a physician specializing in treatment of diseases of the brain and nervous system. My specific interest is in stroke and dementia. I'm also what's called a clinician-scientist. But genetics is only a one part of the story. The other really, really important part, perhaps even more important part, in that it's modifiable, is our lifestyle. I think we need to continue being critical thinkers and asking those kinds of questions about recommendations and advice that we hear online. Where is the evidence coming from? What are the motivations of the person giving you that evidence?
Hello and welcome back to the Neha Jog podcast. Our today's guest is Dr. Aravind Ganesh. He's a neurologist and a research scientist right here in Calgary. He specializes in stroke and brain health and also researches how our memory and cognition change as we age. We talked about what really happens during a stroke, the warning signs to watch for, and how to keep your brain healthy as you age, including a few things most people don't realize until it's too late. And if you haven't yet subscribed to the channel, please consider doing so, as it really helps and motivates me to bring more such valuable content your way. Now, without any further ado, let's dive right in with Dr. Aravind Ganesh. Welcome to today's episode, Arvind.
Yeah.
Thank you so much for agreeing to do this.
Oh, glad to be here.
Could you give us a brief introduction about yourself?
Sure. So I'm a neurologist. So that's a physician specializing in treatment of diseases of the brain and nervous system. My specific interest is in stroke and dementia. And I'm also what's called a clinician-scientist. So that means that I split my time between patient care in the hospital or in clinics and clinical research work. And so I've been doing that in Calgary for nearly 5 years now. Yeah.
Okay, I'm so excited because just anything to do with brain excites me, and neurology is so complicated, but so interesting because
Absolutely.
that organ operates your entire body.
That's right.
Literally. So what got you into neurology?
Yeah, so I started thinking about it seriously during medical school. So when we started learning about the brain, learning about diseases of the brain and the nervous system, I became very interested because it's pretty surprising how some sort of small disease or damage in the brain can have pretty far-reaching consequences for the person in their daily life, and it can completely change their life around. At the same time, I thought that it was very exciting that there were treatments beginning to be available at that time that we could offer patients to change their life around for the positive, right? And improve their disease. And in some cases, like stroke, which is one of the conditions that I'm deeply involved in, you can actually completely reverse the condition if the person is treated quickly with the right approach. So that to me was very exciting, and I felt that I wanted to be a part of that kind of a field.
So do you still would want to do this, like given a chance of going back in life? Would you still be doing this?
Yeah, no, for sure. I think that I still enjoy seeing patients in the space. I still enjoy the research that I do in the space. I won't say that there aren't challenges in the field. There are challenges in every field, and there's certainly a lot of patients that I see for whom I can't do much to change their life around. But in those cases, I still feel like as a neurologist, I can be an important part of their journey and their sort of experience through the disease. And the balance of research and clinical work is something that I find very valuable and kind of very rejuvenating, because if I see a problem at the bedside or in the clinic, then I can go back and try to come up with some solutions for it in our research or lab environment, and then take those solutions and try to bring them back to the clinical environment. And I think that's quite a privilege.
Yeah, definitely. And that gives you more power to, actually be making changes.
Absolutely, yeah.
So you specialize in stroke, and some stroke is very common in Asian population these days. So let's talk about the basics of stroke first. What is stroke actually?
Sure. So, a stroke, broadly speaking, is any sort of damage that happens to the brain as a result of a problem with the blood supply to that part of the brain. And there's essentially two big kinds of stroke. There's ischemic stroke, which is a stroke that happens when a blood clot blocks off the blood flow to a part of the brain, and then that causes that part of the brain to get damaged and essentially to die off. And that's the most common type of stroke. And then the other type of stroke is called hemorrhagic stroke, and that is when there is a tear or other sort of damage to the blood vessel, and essentially there's bleeding out of that vessel into the brain. And so that's so broadly speaking, we can think of those as clot-related stroke and bleeding-related stroke.
Okay. So when I was reading for this episode, I read that when the blood supply stops to the brain because of blockages in the arteries.
Yeah.
So the blockage is due to the blood clot.
That's right, exactly, and that's what happens in ischemic stroke, the most common type of stroke.
Okay.
And in hemorrhagic stroke, the brain dies because, yeah, again, there's a loss of blood supply, but that's because there's actual bleeding that's happening out of an injured blood vessel, and the blood that bleed itself, related to the accumulation of blood in the brain, that itself causes damage as well. Yeah.
So are there any early signs of stroke that you could look out for?
Right. So one of the most common ones that we teach patients about, they can be remembered using a mnemonic called FAST. So it's, that stands for face. F is for face, and that means some droopiness of the face or a facial droop. So one side of the face looks like it's sort of hanging down and not moving quite right. It's a very common sign of stroke. The A in FAST stands for arm. So, you ask the person to put their arms up, and then one arm is weak and cannot move. That's an important sign. And S is for speech. So stroke can very commonly affect our ability to talk, but also our ability to understand what others are saying. So language consists of talking and also ability to understand and communicate. And so stroke can affect that quite commonly. And then the T there is to remind us that time is brain, because when a stroke happens and either there's bleeding or the blood supply is lost, but particularly in situations where the blood supply is lost, the around 2 million brain cells die every minute that that blood clot lasts in the brain without being treated, right? It's a very, very time-sensitive condition. And so the T is there to remind people that you see these signs of stroke, then act quickly, call for help. So FAST is the most common sort of tool that we use to teach people and educate the public about stroke. These days, people also use an expanded version of it called BFAST. So they add a B and an E before it, and that stands for B is for balance and E is for eyes. Because if somebody's suddenly unable to walk and suddenly unable to see, they're losing their vision, seeing double, those kinds of things, that can also be an important sign of stroke.
Okay. When these signs, one person sees these signs, is it still too late?
No, so that is why the T is there, because the T for time, right? So the moment you see those signs, you need to call for help right away. And the most critical thing is, if you're with somebody, don't try to drive them to the hospital. Call 911, because things might escalate very quickly. So what starts out looking like somebody that you might be able to take in a car can quickly become someone that needs some sort of support for their airway to keep it open, or needs other sorts of advanced medical care that can only be provided in an ambulance. Right. So it's very, very important when signs of stroke are happening to call 911 and get help that way.
Right. So all these symptoms that you mentioned, are similar to paralysis?
Yeah. So the paralysis, stroke is probably the most common cause of paralysis
Paralysis.
in adults, sudden onset paralysis in adults, and yeah, these kinds of problems with the face, problems with the arm that I'm talking about are forms of paralysis. But the reason why we have those other components in that kind of be fast mnemonic is because speech and balance and vision are also things that can be affected by a stroke, and they can, in some cases, they can be especially devastating, right? If you just have if you're no longer able to talk, even if you're able to move your arms and legs, life's altered forever.
Right. So, is it right to say that stroke is the cause of paralysis?
Yeah, in it is a cause
A
of
cause.
paralysis. Yeah, there are several other neurological diseases that can cause people to become paralyzed, right? And over different periods of time, brain tumors, multiple sclerosis, lots of different conditions in the brain can cause paralysis in different ways. Spinal cord injuries, so even outside the brain, injuries to other parts of the nervous system can cause paralysis as well.
Okay. So, like as I was mentioning before, South Asian population is most commonly affected by stroke. What would the reason be?
Yeah, so you're absolutely right that we do see, a lot of our people have this condition, heart disease as well. So heart disease and stroke kind of go together as companions, unfortunately. The Certainly some of the ethnic differences in the risk of stroke and the risk of heart attacks and heart disease have to do with differences in genetics between different ethnic groups. Certainly, we seem to be more genetically primed to end up with a lot of the risk factors for heart disease and stroke, which are what we call vascular risk factors. So things like high blood pressure, high cholesterol, diabetes, these kinds of things seem to be, we have a greater genetic predisposition for that. Perhaps, on the other hand, we seem to have less of a genetic predisposition for some kind of autoimmune inflammatory kind of diseases compared to, say, Caucasian or white people. But this seems to be the flip side of it, there's a lot more vascular burden. But genetics is only a one part of the story. The other really, really important part, perhaps even more important part, in that it's modifiable, is our lifestyle. And there are certain aspects of our diet and lifestyle that may have been fine for our health hundreds of years ago in the pre-industrial kind of era, in an agrarian agricultural kind of society, but in kind of the modern world, especially where a lot of us have sedentary jobs, even us right now doing the podcast sitting down, right? So there are certain aspects to the modern lifestyle that simply don't jive with some traditional aspects of how we eat and how we go about our daily activities, right? So, for example, there can be much higher intake of saturated fats, much higher intake of salt in the food that we eat, that increases the risk of high blood pressure. And there can also be kind of an unhealthily high amount of carbohydrate and sugar intake that we have as well as part of our diet, that in the long term can put us at risk of all of these other kinds of problems, particularly when it's paired with a sedentary life and little physical activity. And so I think those are important lifestyle factors to kind of the hectic modern South Asian life, right? That puts us at risk for these kinds of things. And part of that, one important thing to point out is also in terms of body habitus, right? A lot of us are predisposed to having kind of what we would affectionately call like a paunch, or a pot belly, or pate, right? We have a little bit of abdominal fat, and that is an important risk marker for actually a lot of of these bad things that we were talking about, like diabetes, heart disease, stroke risk.
Okay. So you need to really pay attention to your diet and have everything in moderation, but also look at your lifestyle.
That's right. Try to be more physically active. I think that's a very important thing that we can do to try and reduce the risk of these things. It's important to say that having a great diet and having a great lifestyle doesn't completely protect you from these diseases. Unfortunately, these can still happen, but it certainly reduces the risk.
Right. So this can be worked upon. This is preventable.
Absolutely, it's preventable. And even if you have problems like abdominal obesity, you have high blood pressure, cholesterol, diabetes, controlling those risk factors with appropriate medications, with positive lifestyle change, a combination of those things that can reduce your risk of stroke as well.
Right. But is there anything you could do when it comes to your genetics?
Right. I mean, not at this time that we can change our genetics, right? Like that's something that we're born with. But we can change our environment. We can change our lifestyle.
Definitely, you can't change your genetics. But while I was reading or doing some research, I came across, now I can't exactly remember.
Sure.
But some of your habits damage your DNA by 4%. So
right. That's a great point, right? So there's the genes that we're born with, and then there's actually the changes that happen to our cells and to our our DNA, if you will, over time. One of based on different sort of environmental exposures, certainly cancers, for example, are things that happen as a result of accumulated damage to DNA over time. Being exposed to a lot of radiation, for example, right? Classically is a risk factor for cancer, right? Now, as it turns out, interestingly, certain forms of cancer are associated with an increased risk of stroke. So some of these conditions go hand in hand. But one important concept that we're beginning to understand is that certain things that we do over the course of our life, certain choices that we make over the course of our life, changes so some of the ways in which the genes that we have are expressed. So there's certain changes that can happen in the way of like methyl groups being added to our DNA and those kinds of things, or subtracted from our DNA, that relate to certain life experiences that we have, certain life choices that we make even. And this broadly is called epigenetics. So there's genetics, and then there's epigenetics, which is sort of how the expression of those genes changes over the course of our life.
Right.
And what's remarkable and interesting about epigenetics is that those epigenetic changes can also be passed on to future generations. And so this is where, earlier on we had talked about why are South Asians at a higher risk of diabetes? Why are South Asians at a higher risk of X, Y, Z? Part of it is not just genetics, it's also epigenetics. So if, say I'm a Bengali and my grandfather or great-grandfather lived through the Bengal famine, right? There would have been epigenetic changes that happened in my grandfather because he lived through the Bengal famine that changed the way that his body used carbohydrates, the way that it processed sugar and responded to fat.
Yeah.
That would have been critical for surviving a period of starvation. But then those epigenetic changes get passed on, and then 2 generations later, you're in a circumstance where, say, I'm a Bengali guy now living in the States in an IT job, and I'm not moving much, and I'm, eating a Western diet. Suddenly, those epigenetic changes that helped my great-grandfather survive the Bengal famine are going to put me at risk of suddenly having diabetes, having heart disease, right? So it's kind of very interesting that there's this ancient Indian concept of us bearing scars and signs from our past lives, and in some ways it is true in a genetic manner of speaking.
Okay, that's interesting to know. But apart from lifestyle, food, what else can people do to take care of their
Yeah. So
Health.
there's lifestyle and food. There's also getting regular assessments for these kinds of vascular risk factors, right? So very simple actions such as monitoring one's blood pressure, monitoring one's body weight, and getting that under control if that is off. These are also important things that we can do. Monitoring one's blood sugar, monitoring one's cholesterol through regular blood work, and getting that managed with medications if needed. Right now, the American Heart Association has actually come up with a very elegant way of remembering all of these things that I've told you, and it's called Life's Essential 8. So it used to be Life's Simple 7, but then they added sleep as a very important part of it, and it became Life's Essential 8. And it's a nice way to remember the kinds of things that we can do to reduce our vascular risk, improve our brain health and our heart health. And broadly speaking, these are, eating better. So the having a heart healthy diet, less saturated fat, less salt, more fruits and vegetables, olive oil, those kinds of things that we talk about, less red meat. Those are all kind of considered good heart healthy choices for diet. There's incorporating, physical activity as much as we can into our daily routine. And that's both kind of what we call aerobic exercise, so the kind that gets your heart rate up, right? Running, jogging, using an elliptical or a spin bike or those kinds of things, whatever, swimming, whatever works for you. Plus also kind of anaerobic exercise or weight-based exercise, some weight training. Both of those things are good for to incorporate as activity. Then we talk about maintaining a healthy body weight and using whatever combination of lifestyle as well as medications is necessary to achieve that in consultation with your doctor. Then closely related to these factors is managing cholesterol if that is off, managing blood sugar, managing blood pressure, right? Avoiding smoking and quitting smoking. If you're a current smoker, those are valuable things that you can do. And then the final point is actually getting a healthy sleep and following healthy sleep habits. This is something that we're beginning to appreciate as being very important for brain health and well-being, and certainly something that a lot of us struggle with.
Definitely. But first, I want to talk about the first or second point that you mentioned, like eating olive oil and heart healthy diet.
Sure.
From, I've been a lot into diet and I have been looking into it.
Yeah.
So, but there are like tons of advices out there.
Yes.
So, but what I came to understanding and I've made peace with, eat what your grandmother has been eating.
Yeah.
Okay, so
depends on what your grandmother has been eating. That's true.
Because I am from India, so she was eating very healthy diet. So there was no McDonald's, KFC.
So-called sattvic food and these kinds of things.
Yeah, and they were farmers, right? So they were eating fresh meals 2 times a day.
Fair.
Now, obviously, I have to, because also genetics and my body is, used to that sort of diet.
Right.
Maybe.
Yeah.
That's what I've come across.
Yeah.
So obviously, I don't want to eat 10 chapatis if they were eating 10.
Right.
I should come down to looking like I'm sitting all day. Maybe I can eat 1 or 2 chapatis.
That's right.
But still eat my traditional meal that my body and my genetics is used to.
Yeah.
Is that, how do you?
No, I think that's not an unreasonable way to approach all of this, right? So the traditional sort of kind of medical advice that you will see in through resources like the American Heart Association is that people should follow more of, sometimes you'll hear this word, a Mediterranean style of diet or a Mediterranean style of eating. And does that really mean that you should eat what Greek people are eating? No, that's not really what it means. It means that there are certain aspects to Mediterranean style of living and diet that was felt to be healthy. But there are many components of that you will see reflected in, the diet of healthy grandparents and prior generations on the South Asian side as well. For example, an emphasis on eating lots of fresh fruits and vegetables, right? A lot of our predecessors were doing that, right?
And millets.
And if you and they were not eating these things in a heavily processed manner. That's the other thing. Like our food now is heavily processed. That also we understand to be a problem for several things in life. And so fresh fruits, vegetables, healthy grains, whole grains, these are things that aren't just unique to, Mediterranean culture or Greek culture. There are elements of that in many traditional diets, including, kind of original South Asian diets. One of the we already talked about this, the amount of carbohydrates, right? So the 10 chapatis kind of example is an interesting one because especially for modern life, you do want to have kind of a higher ratio of fruits, vegetables, and protein compared to carbohydrate, because for most of us with our kind of office jobs and these kinds of things, indoor jobs, the carbohydrate requirement isn't that high. Right. So the just making sure that we optimize the portions on the plate, right, to something that is a bit more reflective of kind of modern living. That's a change that you can make. But there's certainly no reason that you cannot eat, Indian foods or Indian ways of cooking meals. There are things that we can do with the way that we prepare Indian curries and these kinds of things, where we can make more efforts to reduce the amount of salt that we're using, because traditionally sometimes salt is quite overused in our cooking, and when my patients worry that their food won't taste good if they remove salt, I tell them, look, we're from the culture of spices. Salt is just one option. Look at everything else in the spice dabba and add more of that. You can add more pepper, add more, chili powder, all of those kinds of things, lime, make use of the entirety of the spice tradition that has been passed on to us. And then food will stay tasty.
True.
But at the same time, it'll remain healthy because you're cutting down some of the salt, you're taking away some.
Yeah. And also, on top of all this, there was so much science behind the food that they ate. There was seasonal fruits and vegetables. What would you eat during winters and summers?
True.
How much quantity you're eating during summer. So we ignored all that. But now people are going back to understanding that why my grandmother did that.
Right.
Why did they used to eat all the winter vegetables are different.
Right.
And there is all whole science behind that. So
I mean, and even independent of sort of health aspects of that, which, are, I suppose, might be less clear, there's certainly kind of the buzzword these days is sustainability. And those ideas of kind of you adapting your diet with the change of the seasons and what the land gives you is sort of a pretty core tenet of sustainability, right?
Definitely.
As opposed to saying, I insist on eating watermelon all year round, right? So,
that's what we are doing here in North America.
Right.
We have fruits year round. It doesn't, I don't...
we don't think about what that's doing to the land or where that's coming from.
Sometimes it's hard for me to wrap my head around the strawberries that I'm eating in summer, winter, and year round. But last point that you mentioned is the American Association added sleep later.
That's right.
Again, I have been, according to me, I feel like sleep is such an important part of your brain health.
Right.
Almost essential.
Yes.
So let's talk about sleep.
Yeah.
Do humans, on an average, require 7 to 8 hours of sleep?
Right. So this is... kind of a question that we continue to learn a lot about. What is clear is that, the optimal amount of sleep certainly varies from person to person. And it also varies depending on age, right? And this is something that we intuitively know. Babies spend much more of their day sleeping compared to to an adult human. But that's because their brains are developing and growing, their bodies are developing differently, and so their sleep-wake cycles are different, and so they're going to need more time sleeping. As we get older, that requirement gradually comes down. But if we think about it as a typical adult requiring between 7 to 9 hours of sleep, that's probably a reasonable estimate. Most of us, if we get 7 hours of sleep, are going to feel reasonably well rejuvenated, especially assuming that we don't have other problems in our sleep, like sleep apnea, for example, which is an important risk factor for blood pressure and also for stroke, that reduces the quality of your sleep. Then if you have those kinds of problems, even 7 hours won't feel enough, even 9 hours won't feel enough, and you'll still feel tired when you wake up in the morning. And that's an important sign that, you probably need to talk to your doctor, because why are your sleep needs so different, right? There might be something about the quality of your sleep that needs to be, looked into. But most of us, between 7 to 9 in adulthood is a good amount of time. Children's who are, preteen will often need, 10 hours or more of sleep. In contrast, right? And then by the time you're a baby, you're looking at 12 or more hours, right? So much more time. So it's variable according to age. And the question behind the adequate duration of sleep is also like, why do we need this much sleep, right? And that's something that we're also beginning to understand a lot about. You're right. For a long time, we have had this intuitive understanding that, you need good sleep for good health, right? The reason the American Heart Association didn't have it before wasn't because they didn't think sleep was important. It's just that the connection between sleep and heart disease and stroke specifically was something that's being increasingly appreciated now, right? You're right. Good sleep has always been important for good health. But the other really interesting piece that we have learned recently over the past few years is that sleep is also important for how our body clears toxic proteins from the brain. So when as I said in the beginning of the interview, I'm a stroke doctor, but I'm also a dementia doctor. And the one of the most common forms of dementia, Alzheimer's disease, is caused by an accumulation of abnormal proteins called amyloid and tau in the brain. And one of the fascinating things that we've learned in the last few years is that sleep is when these kinds of toxic proteins are cleared by the body and from the brain through a system called the glymphatic system that we didn't really even know existed 10, 15 years ago, right? So we're beginning to understand a bit more fundamentally kind of what are the useful processes that happen during sleep that help to keep our brain healthy.
Right. So you are talking in a technical language,
That's
but
right.
in a layman's term, I thought, or what my understanding related to sleep was, you need sleep for your body to heal. Your body repairs and it heals when you sleep.
Yes.
So you need sleep.
That's right.
But my question comes down to first category of people who sustain on 3 hours and 4 hours of sleep. And they feel like this much is enough for me. I can't sleep anymore. Or this is how much I sleep and I feel better.
Right.
Is that okay? That human being needs that much sleep? That is normal? Or they should consult a doctor?
So this is a great question, right? I mean, like I said, we know that there's individual variation, right? This idea that most people need 7 to 9 hours of sleep comes from sort of our understanding of what is the distribution of normal sleep among like a healthy adult population, right? But within that kind of bell curve, if you will, certainly there are likely to be some people that need more than that, and there's likely to be some people that need less than that. Rather than force people to sleep beyond what is comfortable to them, what advice I generally give people is, do you feel adequately well rested with these many hours of sleep? Is it enough to keep you through the day? Are you having to compensate during the day with naps or something else like that? If you are having to compensate with additional sleep, or you're feeling, quite drained as the day progresses, chances are that you're not getting enough sleep. And it might be, other pressures of lifestyle or learned behavior that keeps us with such a short duration. But on the other hand, if you're extremely high functioning, you're doing very well, you're not feeling tired, and importantly, you're still feeling mentally well, right? Then a lower amount of sleep might be okay for you. So it's variable.
So another thing is, as humans, if you train your body to do something for a month or two, your body will adapt that. So maybe I was sleeping 9 hours, but due to like hectic lifestyle and stress, I've been sleeping 4 hours for 2 months, 3 months. Can you train your body to do that? And then even if your body requires, it has been trained to, okay, this is how much I'm getting and this is my regular general sleep.
Yeah, and there's entire kind of lifestyles and philosophies that are built around this topic, right? I'll tell you, and there's all sorts of ranges of practices ranging from what I would say is, just maybe a variation of normal to something that I'd probably say is kind of toxic behavior. There's a range of kind of advice and lifestyles that you'll see online. And the more extreme versions are probably too much, right? So one thing that I'll never forget is I remember reading about some, Wall Street guy that was, high-strung stock investor that was advising people to nap for 20 minutes every 3 or 4 hours. And then that would be all that he would do. And he would never get like a full night's sleep, right? But this was his way of kind of staying up with the times and checking all of the stock markets and making sure that he did all his trades in, a continuous fashion over the course of the day. That's probably a pretty extreme example of how a human was not intended to live, because we know through our analyses of what happens in the brain during sleep that the brain needs to progress through certain stages of sleep for sleep to truly be restful. So you need to go through different stages of kind of stage 1 rapid eye movement sleep, stage 2, stage 3, stage 4, these kinds of deep stages of sleep in order to actually get restorative sleep. And so you try to cut in too much to that and try to do extreme sort of body training, you're probably not doing yourself a favor. But that's probably the best that I can tell you right now. Yeah.
Okay. But is like chronic sleep deprivation related to dementia or Alzheimer's in old age?
Yes, it is. So we do know that people that on average are ending up with much less sleep than is typical for a healthy human, certainly over long periods of time, they are at a higher risk of ending up with different types of neurological disorders, particularly cognitive decline. Now, have we shown that getting such a person to sleep more reduces their risk? No, we haven't, right? So this is part of kind of how our understanding of risk factors evolves and changes over time. There are some things that we know are associated with better outcomes than others, but modifying them doesn't necessarily mean you're going to end up doing better, right?
But you can't go back in time for that individual. So even if you were to test okay, let's make you sleep more, how can you go back in time and do that?
If you were to do it, for example, there are some lifestyle-oriented studies that are looking to see if we kind of improve the quality of sleep in one group of people compared to letting a control group, carry on what they're doing. Kind of these sorts of randomized controlled trials, we call them in our field. We are able to use those instruments to kind of sometimes show the benefits of certain types of lifestyle modification. And people have used that to very definitively show that reduced salt intake, improved diet of the kind that we've talked about, heart healthy diet practices, improved physical activity, all of these translate into tangible benefits for the body. It has been more difficult to show that increasing sleep in X person versus Y translates into, say, a reduced risk of dementia or a reduced risk of heart disease. These are things that we understand based on these associations from studying large groups of people. So it's an evolving area still for that reason.
Right. But you're also a dementia expert. So what are the major causes of dementia?
Right. So the thing that helps that discussion is that all the vascular risk factors that we talked about that are relevant for heart disease and stroke, they're also some of the most important risk factors for dementia, right? So, and that is actually good news because that means that if we take care of these things, we can protect our heart, we can protect our brain, not only from vascular disease, but also from dementia and cognitive decline, memory loss with age, right? So that's great news from a lifestyle standpoint, because it's not like you have to do very different things for one versus the other. But there are some risk factors that are particularly relevant for dementia, like, for example, traumatic brain injury, right, which is also modifiable. So making sure that we are protecting our heads adequately over the course of our life. Particularly trying to avoid, repetitive injury in the form of concussions and head and other kinds of traumatic brain injuries over the course of life. That's quite important. Then it also There are also certainly, just like for heart disease and stroke, genetic risk factors. There are some specific genes that are passed on through families that greatly increase the risk of dementia, but also probably a bunch of smaller genetic changes passed over across families and communities that also increase risk compared to others. Those are not things that we can change, unfortunately. And so people that have a family history of dementia do have a higher risk of getting it. But in most cases, just because someone in your family had dementia does not mean that you're going to get it, right? So it is not like you are fated to develop it. You still have the power to modify and change that outcome over the course of your life.
Okay. But again, are there any signs of dementia?
Right, absolutely, there are. The earliest signs of cognitive decline in someone tends to usually be their short-term memory declining, so meaning their ability to retain information about things that have happened recently, their ability to learn new information and retain that information. That's a pretty classic kind of early sign of cognitive decline. That being said, there are also several other ways that people can have early signs of dementia other than short-term memory that can include changes, gradual changes in their ability to communicate. So increasing trouble finding the right words, for example, that can be an important sign. There can be issues with their ability to plan and organize activities in their daily life, their ability to make appropriate judgments and decisions. These kinds of things might be changes that are noticed in certain kinds of causes of dementia compared to others. Broadly speaking, we call these executive function problems, other than just memory. Ability to pay attention, concentrate, as that suddenly seems to newly develop and deteriorate in somebody, that can also be a sign. And all of these things that I just talked about are broadly related to problems with thinking and memory, right? And certainly, if these problems are noticeable to others, that is a sign that there is something seriously wrong that should be investigated. It's important these days not to wait until the memory problems are so severe that others are having to take over activities in our daily life, like our finances or our medications and these kinds of things, because we can't manage them anymore. It's important not to wait until that late, because that is when we describe somebody as having dementia, because their cognition, their thinking has declined to the point where others are having to step in to help them with their daily activities, right? Certainly, a lot of the people that I see in the dementia clinic already have dementia, but it's helpful when you see them at a stage that is before that, like mild cognitive impairment, we call it, because there are certain things that we can do to optimize their risk factors sometimes that can maybe keep them in that stage or reduce the progression to early dementia. A lot of it relates to kind of lifestyle factor management. There are some medications emerging, some recently approved in the States, that for certain kinds of dementia, like Alzheimer's disease, might be able to slow the progression of the disease. And that is a very new and interesting development in our field. Traditionally, we haven't had that option. We've only been able to give people kind of symptomatic medications, which means it doesn't do anything for the underlying disease, but it helps you sort of kind of deal with symptoms on a day-to-day basis. But yeah, I mean, so these are so this is sort of kind of a high-level overview of kind of what the signs and symptoms of dementia can look like in somebody. But one point that I do want to make is that all these signs and symptoms that I spoke about ultimately do relate to our way of thinking and cognition, broadly we call it. But one really important thing that we have learned, including in our own research group in Calgary, is that in a lot of people, perhaps even before memory problems and thinking problems begin, they have late life onset of behavioral changes and mood changes as well that sometimes precede or accompany the development of these more typical signs of dementia. So people describe this as kind of behavioral impairment. So for example, that can mean somebody that was very outgoing socially starts to become more withdrawn, right? And they've never been depressed or anxious or anything like that before. So later in life, they suddenly start withdrawing from a bunch of things, become more constrained in their approach to others. They seem to stop caring about things that used to matter to them deeply, right? They stop showing the same warmth or affection for others. They become much more irritable. They become much more controlling, or they seem to lose their filter, right?
Mm-hmm.
All of these kinds of behavioral changes, that mood and behavioral changes in later life, can also be kind of a marker for future cognitive decline as well. And that's something that we've begun to recognize.
But this, on so many levels, can be misjudged as old age.
Yeah.
Right?
Yeah,
that,
absolutely.
Oh, he's just old. Or they are retired. Maybe that's why they're,
right.
and ignored.
Yeah, no, absolutely. And of course, to some extent, our life priorities change when we get older, and that is normal. But, these kinds of things that I'm talking about are things that come across as being very much out of keeping for that person's nature, right? And so when we start to notice these kinds of symptoms, we do need to think about, is this more than just changing life priorities? Is it actually, a fundamental change in the person's personality? Right. And that's what we're talking about here, right? And so if someone that used to golf a lot gives up golf because they now have a bad back and their joints aren't what they used to be, that's very different, as opposed to somebody that gives up golf because they suddenly stop caring about golf, and they suddenly seem don't want to engage with their friends that they used to hang out with, and those kinds of things for unclear reasons. They don't seem motivated. That can be an indication that there is some sort of social withdrawal happening, and we need to pay attention to that.
Right.
People that are well versed in mental health will hear some of the things that I'm saying and say, well, these kinds of things also happen when people become depressed, right?
Yeah.
And as it turns out, depression in late life can be an important risk factor for cognitive decline. So if we want to expand from that life's essential 8 to having a 9th thing to take care of in relation to dementia, I would add taking care of your mental health, right? Taking care of your mental health and making sure that you don't let these problems go untreated and unattended to, right? Manage anxiety, manage depression as needed, right? Through counseling, through medication, these kinds of things, because that's also an investment in your future brain health.
Right. Now that we are talking about mental health,
right?
How much physically, getting out in the nature, walking or doing exercises affect your mental health?
Yeah, so it's physical activity, like I've already said, has a lot of benefits for the heart and for the brain in terms of preventing heart disease and stroke. It's also very valuable for protecting our cognitive function and our memory and thinking. In fact, there have been now a couple of large-scale studies. One of them is called the finger study. The other one's called the pointer study. 2 really big trials that have been done following older adults, looking at various types of optimization of lifestyle, some of which have included kind of sleep and mental health, by the way. And they've been able to show that, incorporating healthy diet, incorporating physical activity, all of these things in a very rigorous manner can reduce cognitive decline in people. So this is an example of lifestyle-based randomized controlled trials that we have that say that, what these things that the doctors are telling us to do, they actually make a difference when you implement them in a systematic fashion, and people do better than they would have without it. So we know that those things make a difference. You specifically asked about nature, right? So that might have unique benefits in and of itself, actually. And there's definitely positive mental health effects to being out in nature. Remember, that's where we all came from. So there is kind of a returning to your to the wild that that is mentally beneficial for human beings, perhaps.
Mhm.
But the other sort of interesting thing is that it seems important enough that one of my colleagues in Calgary had an entire research program that was about taking people living with Alzheimer's disease and their families out in nature, actually, to try and help improve their behavioral outcomes, to try and improve their well-being. And really, let's make a difference, and because social isolation and being cooped up at home, uh, those things do take a toll on people, and we saw a lot of that during the pandemic. Right? It reinforced the importance of kind of us seeking each other out and doing physical activities and also being out in nature.
Right.
The people in the past used to talk about life having several different stages, and the final stage, one of the final stages after you've had what's called the grihastha phase of kind of living through household, was this thing called vanaprastha, which literally means going to the forest, right? And so there is this appreciation of the fact that nature has value and has and it plays an important role in life, but we don't need to retreat to the forest to get bits and pieces of nature in daily life, and that can still be helpful for us.
Right. Like, especially like here in Calgary, we have such amazing parks and nature. So you should always take advantage of it.
I think so.
But also, like during winter times, you should still make an effort to get out.
Yeah, absolutely.
And not just, be in this zone that, okay, winter, I'm just going to sit down and sit in the house, because that affects your mental health.
Totally.
So, because if I tell to people, nobody's going to take it seriously. But when it comes from a neurologist, people are going to trust you more.
Yeah, no, and I'll say, a lot of people suffer physically and mentally during the winter times from kind of a loss of physical activity and a loss of engagement with the outside world, right? So there is an entire term for this called seasonal affective disorder, or SAD, right? Where during the winter times, people find themselves becoming much more despondent and depressed, right? And one of the blessings of living in a place like Calgary is that we actually have a lot of sunshine all year round. And so even in the depths of winter, actually, if you're able to, bundle yourself up and spend a few minutes outside, I'm not talking about spending hours outside, spend a few minutes outside with some loved ones and take that in, that can still be helpful for you. And yeah, like you said, we live close to lots of parks and trails, but we also live close to the mountains, and those of us that are able to make it out to those kinds of places, these are places that are beautiful all year round. And there are lots of kind of winter hiking activities and snowshoeing activities and these kinds of things that are lower intensity. Not, you don't have to be a skier or a skater to enjoy winter. There are these kinds of things that you can also do to keep those kind of levels of activity up a little bit.
Definitely. Going back to the food, before wrapping up, online these days, there is like anyone and everyone trying to give you advice, for brain health, eat this, eat that, eat chia seeds, eat walnuts. Are there any food groups that actually affect your brain health, or just eat healthy food? That's
right. So that's a great question. And you're absolutely right. There's a big market out there for trying to sell different kinds of fads to people that, you have to eat this kind of berry or this particular kind of supplement, even, right? It's not even food. Sometimes it's even supplements that people are trying to sell to you for your health. And for the most part, as long as you're following, like I said, kind of these principles of a heart healthy diet and a brain healthy diet, you're probably going to be fine, right? Sure, there are certain kinds of specific food items that may be associated with better health outcomes. But there's nothing quite so definitive that I would tell people, you should preferentially eat this even if you don't like it, right? Because that evidence base is just not that robust, right? And nutritional research by itself is a very challenging space, right?
Yeah.
And at any one point, there's a very great scientific article that looked at all the nutritional evidence and aggregated it and showed that actually almost every food you can think of has been shown to both cause and prevent cancer, right?
Yeah.
And so that's an example to say that, these there's limitations to our ability to understand some things just from simple diet questionnaires and these kinds of things.
Right.
And until and unless people give you some rigorous evidence to help, there's not that much value in changing your life around for a single food item.
Right. That's good to know coming from you. So not to go and buy in the store some nuts or seeds that are good for your brain.
Especially if you don't like them. If you like them, enjoy them. Take all the nuts you like and the berries and fruits that you like and incorporate them in your diet. But, there's no reason to lose your money over that either. So,
right. Yeah. But the second most, what I can say, very popular these days is screens and social media.
Yes.
Even kids are like, the dopamine that you get from watching that screen is something on another level. So let's talk with kids' perspective first.
Yeah.
How much screen time is good for kids? Is there any screen time that you should give or not? And how it affects their brain because it's developing at such a high speed?
Yeah. So, and again, this is something where evidence continues to emerge and grow, but we do know that screens can have a lot of behavioral control over kids, right? They can really influence what kids see as valuable and useful and how they choose to spend their time. And certainly there's evidence we have that increased exposure to screens in early life can affect people's attention spans. It can affect children's ability to learn. It can affect also their ability to engage and play with others. And this is not an accident. This is even more so with modern screen technology compared to the TV that you and I grew up with, because of the fact that, market research and technological research has been primed to make these devices and screens and the different apps and tools and videos that go along with them as addictive as possible. That is the business model. The business model is to ensure that you love your screen and what is on it more than anything else that's happening around you. So it's not an accident. That's a feature. It's not a bug, right? It's a feature of this thing. And so that is how it's intended to be consumed by you, right? And with all our knowledge and with all our so-called worldliness. Then let alone a child, let alone a baby. What chance do they have, right? In the face of something so overwhelmingly powerful, right?
Definitely.
And so this is where the advice comes in to limit the exposure of screen time to children, right? And when is a safe time to introduce children to screens? That remains an unanswered question, but probably the later the better. If your child is using an iPad or watching TV or videos, those kinds of things, it makes sense to also set limits around it. It makes sense to give them certain warnings about time and enforce those, right? So that they also know to move on to something else, right? After that one session is done, let's say. It is always helpful to teach children about boundaries. It is always helpful to teach children about expectations and limits early on in life, because then that translates into good behavior and good learning of other life skills later on. That's well known and well established. The one thing that I will say is you will see a lot of children being given a screen as a way to prevent bad behavior, right? Oh, I'm outside at a restaurant and I just want to eat. Let me just give the kid a screen, right?
Yeah.
Oh, we are on an airplane or something, or oh, I'm in a car and I just want to drive. Give a screen to my kid and my kid won't ask me questions, or my kid won't, make noise or be active. But part of what we have to remember is, earlier on we were talking about how, there are certain aspects to our modern lifestyle that are actually incompatible with good human health, right? So there are also some components of our modern social expectations that are incompatible with good child health, right? So a child is supposed to explore the world. A child is supposed to be curious and ask questions, and sometimes make mistakes and say the wrong thing, or do the wrong thing, and be a little bit active, or those kinds of things. And so our role is to engage and provide feedback, not to give a device and try to control their behavior that way. That's not how we were intended to grow.
Right. It's just like such a stressful world that we live in.
Yeah.
And I've seen parents like, they're just tired working the entire day.
Of course.
And maybe once a weekend they're going out for a dinner.
Yeah.
And the mindset is, I don't want to do the babysitting here as well.
Of course. I completely understand that. Yeah. I mean, I have a young son, and I go through the same kinds of choices, and I don't always make the right ones, certainly. And I have nothing but deep empathy and sympathy for parents that find themselves overwhelmed and without support, and then the screen or the TV seems like the next best choice, right? So I would never want a parent to feel guilty about that because of their circumstances. All that I'll say is that if we have the luxury and the ability to be involved in our child's daily life, and then we should leverage that to reduce the amount of time that they're spending with screens or with other sorts of things, so that they can do more of what it means to be a healthy human.
Right. What other advice you would give, especially related to kids? Because, as parents, you're always so paranoid and always thinking about what is the right thing to do with your child.
Right.
Like screen time, phone, this, put him in 100 activities to do, or I don't know. They're just, what is good for kids' health, or what should you be doing?
Yeah.
Is enrolling your kids into 10 classes good for them, or is it not good for them?
Right. I'll say you should ask me in another 10 years, and then I'll be able to tell about where all I've gone wrong in making these choices. But we do know that it is helpful for kids to have some structure in their lives. It is helpful for kids to be engaged in various different things that stimulate their curiosity, that keep them physically active. But the other important part that I'd say is that it's also very important for kids to be happy, right? It's also very, very important for parents and kids to spend meaningful time together. And so, if I have to choose between putting my child in a structured activity in the time that I have at home versus being able to spend some time with them, I'd probably choose spending some time with them. Do you know what I mean? So, there's a balance in all of this, right? Between kind of getting kids activities that are helpful for them versus preserving the health and happiness of the family unit, right? And preserving your own health and well-being, because does it really make sense for you to be driving around all day from one activity to another on your only day off? Maybe not, right? So there's some healthy balance there. Nobody knows how to balance that equation in your life except yourself, right? And you have to kind of work on that and think about what works for you and your family and your child. And my current thinking is that it doesn't make sense to force a child to do an activity that doesn't bring them happiness, right? This probably doesn't seem like a good idea in the long term for your relationship with the child, right? But yeah, I don't think anybody has this right, and I don't think there's any one size that fits all. But these are some guiding principles to think about.
Right. And I think that is a good perspective to have, is like, I would rather spend time with the child like play and learn and
Of course.
play or
Yeah.
read or do something
Yeah.
rather than always being into this, oh, you need to
Right.
learn this, you need karate and
Right.
maths and
Right.
science and robotics and everything
Yeah.
you need
Yeah.
to learn right now.
Absolutely. And I mean,
So-
I'll tell you one lesson that I learned from my own son, right? And so my son's 4 years old, and when I'm driving him to daycare or to different activities, he thrives on stories, and at some point, as a dad, I discovered that you can play audio podcasts in the car, and I, instead of me telling stories, I started playing some stories that my son would like to listen to in the car. We did this for a while, and I thought, okay, well, my life is suddenly so much easier because I can just think about driving, or or maybe check some text messages in an unhealthy manner instead of trying to think of a story. And then one day my son just straight up told me, hey, instead of playing a story, why don't you tell me a story that's more interesting, right? And so it was kind of a lesson that I learned from my own kid, right? That technology is helpful, but the relationship probably matters more.
Yeah, and I totally share the same sort of energy here, because what I have tried doing with my son, he thrives on stories as well. But most of the times it is so boring, and my creative brain is so off that I can't create stories and tell you. That is so much not me. So, but I've started sharing my day with him.
Right.
So if we are in the car, I'll tell him how my day was. In my office, this is what I did. And my boss told me this, and I had to do this. I went out for lunch.
Right.
And he enjoys that. Sometimes something is so funny to him, and he'll start laughing. Oh, you did this and that. So that is my bonding time. He learns about me, what I do, and I'm getting to share. Anyways, here the social life is not very wonderful. So I don't get to talk to my friends on daily basis. So I rather talk to him. Just refrain from sharing any secrets because it might come out anywhere.
That's right. You got to be careful about that.
Very careful. So that has been amazing, and that has made our bond even more stronger. And he knows more things about me. Just sharing my experience.
No, absolutely. No, I think that's a great example.
Yeah. Any last advice or message you would want to give out?
Yeah, no, I mean, what I would say is, I think one of the things I've enjoyed about our conversation is that we've talked about how there is a lot of information and signaling and advice that we get from all corners of the world these days, but it is helpful to think about where those sources of advice are coming from, what's kind of the evidence behind them. I think we need to continue being critical thinkers and asking those kinds of questions about recommendations and advice that we hear online. Where's the evidence coming from? What are the motivations of the person giving you that evidence, right? Or that advice, or giving you that advice, I should say. And then recognize that there is still a lot that we don't know about the brain, and certainly about life and how to live it. But we keep learning from the best available information, and people like myself that are involved in research, we try to add some knowledge as we go along as well.
Right. But the only sad part I feel about all this is you're an expert, and you are being so honest. Okay, like there is no brain food that you should be eating. You're giving all facts out, which might seem so boring to people. Okay, but some other influencer is going to come on your screen and sell something so passionately and convince you that even an expert is telling you don't believe all that. I would still go and buy something because you're telling me that. So people who are not experts are so good at selling.
Right.
That experts like you would be left behind.
Absolutely. Yeah, right. I mean, the soundbite is always what works out better in this day and age, right? I used to write a a health column for the Calgary Herald actually a long time ago.
Okay.
That used to talk about the evidence for different kinds of things, and why we should do them and why we shouldn't, and we had a good readership and everything. But at one point, they basically told us that look, we do want to move in the direction of something that is a bit more flashy, a bit more kind of clickbait kind of
Exactly.
oriented, because that seems to be what gets the ads sold at the end of the day, right? So,
Yeah.
so it is a challenge, and I think everybody in this day and age is incentivized a little bit to go in a kind of a flashier direction, if you will. But yeah, we've already talked about flashy screens and how they're not good for you. So
That's true. Hopefully, people understand.
Yeah.
But it was amazing talking to you.
Yeah, likewise.
And this is such a interesting subject.
Yeah.
I would talk to you for 6 hours about it because I want to learn. I have so many questions, curiosity.
Yeah.
But this was good enough
No,
for
thank you.
at least for people who want to scratch off the surface,
Of course. Of course.
So thank you so much for taking time out and doing this.
Yeah, you're very welcome. Thanks for having me.
Thank you. And if you enjoyed this episode and got to learn something, don't forget to subscribe to the channel, and I'll see you in the next one.